Hello ladies and gentlemen, Ollie here, and welcome back to another one of these end of week diary videos. I've decided I'm actually going to do them every 2 weeks. I think that strikes a happy medium between keeping things relevant and not kind of churning the same video every week. Because while different things do happen every week, I think extending the period lets me select out some of the more choice material I want to talk about instead of just going through absolutely everything. And I apologise, my voice sounds a little bit ropey. I've had a cough like the last 2 weeks. Well, I'll go into that as the video goes on because an illness has sort of defined the last week and a bit of my existence, but here we are. So last Monday we were in hospital back at George Eliot in Nuneaton, and we went round with a really kind consultant who when we were finished, after we'd kind of been to see the patient with her, she actually went back. We kind of all went and sat in a cafe area, and she talked us through the biology and biochemistry of what was going on as well. I thought that was a really nice way of her to debrief. And that day we also prepared a couple of patients to talk to because we had to submit a case report, so that was due on Tuesday of this week, that being Tuesday the 13th, I think, and we knew that we were going to have to come back on Wednesday afternoon, so the previous Wednesday, to carry out the required interview and physical exams with the patient to submit our case report. And to do that required going through things like cardiovascular exam, a general physical exam, and doing some mental state assessment as well as a full history and finding the drugs list and coming up with a management plan, and there was a lot that kind of went into it. Anyway, we realised we were going to have to set up a specific time period to do this because we didn't have enough time in our schedule teaching, so we cleared it with 2 patients to potentially come back and speak to them on the Wednesday. Then the Tuesday of last week I spent studying, basically. I went over a load of Block 1 and Block 2 material, and I think that actually touches on something that I want to talk about, which was that I've realised that what I was trying to do was to keep up with the material, so I was doing my Block 3 stuff and then going home and doing some Block 1 stuff, which in theory sounds fine, but what I found in practice is that my consolidation for Block 3 in terms of the material that I've actually taken on board and can remember long term is virtually nothing. And I think that is due to... So to explain how I was doing this, I'd go in, have a day of studying brains, and then go home and study stomachs and kidneys again. And while I understand the content, but I'm clearly not putting it into long-term memory, and I think that combination of doing one thing all day, then going home and doing something else, is preventing me from consolidating the Block 3 material. I can remember the Block 1 stuff pretty well now, but clearly that's not the way I need to be doing things, so I need to come up with another strategy. So we spent that Wednesday learning about various types of Alzheimer's disease in CBL, which is obviously a very relevant thing for the neuro block. And the funny thing, I guess, about Alzheimer's disease is that you can't confirm a diagnosis until after the patient is actually dead, because it's a histological feature, things called Lewy bodies, kind of accumulations of malformed proteins that would indicate like Lewy body dementia. So we went through trying to identify as many kind of extraneous factors of dementia that we could put together to try and help us with the diagnosis in that case. Then in the afternoon, 3 of us went back to the hospital and we met the second of our patients. So the first one had actually been discharged, as we suspected he might be, which is why we prepared 2 patients. So we went and saw the other one, and we were with them for like more than 3 hours, I think. We got there at about 1 and it was after 4 by the time we left. So 2 of us, myself included, did the physical exams and took the history, while the other person that was with us went and found all the relevant documents. And that way we were able to compile all the information from things like the chest x-ray, drugs list, and all the other written notes from admission. We were able to combine that with the history and the exam results to kind of generate this whole picture that we could use for our case report. And again, this experience was made much more kind of amenable by the fact that the doctors and nurses were all really nice to us and helped us with what we were trying to do. One of the doctors let us log in with their credentials so we could see things like the chest x-ray and the relevant blood results and things like that, so we could really build up this holistic picture. The Thursday I actually took the block 3 formative, so it opens on the Thursday of the final week of a block, then you have to do it by the following Wednesday. So I did that, did it closed book, failed it. This is actually the first formative exam that I failed. I passed the short answer questions, I got like 75%, but then I was not close to passing the multiple choices. I got like 52% or something like that, and you need 60% to pass. And I feel like I know the anatomy pretty well, but that's again the only stuff that I like go home and will do for pleasure, is anatomy. Like the pharmacology and physiology, a lot of the time I was just grasping at straws, and I really need to work on consolidating that material. The other thing about this, I actually posted publicly about this, and people were being so supportive. I think they maybe thought I was in a worse mood than I was in, but everyone was super lovely and very encouraging, and you know, it just goes to show how nice the kind of community of people that I interact with is. Then Friday was pretty uneventful. We were doing more mech and history taking in clinical skills, and then anatomy was just a roundup with a load of clinical scenarios. I think there were 9 stations from all over the block, and you just had to work through them, and we got through them pretty well. Again, I was mostly able to contribute anatomy type things, but it actually came in really useful in solving some of the clinical scenarios, so I guess every little bit does help. And then the weekend is kind of where things started to get worse, so I went to bed with a headache on last Friday night. Didn't really think very much of it, but then woke up like very early Saturday morning and the entire room was spinning. It was really, really unpleasant, and I was full of like sort of flu symptoms, and I was throwing up a lot as well. I was in a really bad kind of state, so spent all of Saturday completely sparked out, and then Sunday again I was still feeling very, very rough, but one of my course mates had to come over and copy up some of the notes, so he was the guy that had been getting the drugs list and checking the x-rays and things like that, so he had to come and copy my side of the notes, so I sort of dragged myself downstairs, helped him kind of facilitate that, and I copied up what he had, and then he suggested going for drinks because he'd come through to Leamington, and I think the look that I apparently shot him was quite unpleasant. I just was absolutely not in the mood, so I went back to bed. Then Monday I felt a little bit better, still very kind of cold flu symptoms. Thankfully the spinning room had stopped and I wasn't being sick anymore. So I kind of was guessing at the beginning that I had norovirus, because quite a few people in our year have come down with it, I think with us being in hospital more now, but I don't think it was that, because it was just kind of flu, like bad flu at this point, but only those sorts of symptoms. So I went into uni on Monday, we had the lectures. We only had half a day because the other group were on clinical skills. Like the other half of the year we would be in on Tuesday instead. So I went home, slept the entire evening, like immediately straight through. And this caused problems because on Tuesday we were supposed to go into hospital and hand in these case reports, which they were not small pieces of work. Like you had to write up all the notes, come up with a management plan, and write an essay as well on like a relevant issue to your patient. And given that I'd only done it on the Wednesday, been busy with the formative through the Thursday, I hadn't done it, basically. So then, still kind of a bit delirious. I felt really, really bad on Tuesday, so I didn't go into hospital, but I spent the day trying to bash out this case report, which I did manage to do by the very end of the day, and even though I hadn't been into hospital, which I don't think would have been a good idea anyway, given the condition I was in. I was probably very infective. I sent my case report through, and they did agree to mark it, which was really, really kind. So I'm not actually behind because of that. I won't suffer any penalty, and I genuinely don't think it'll pass to the required standard, but we do get feedback and then we are able to resubmit. So I thought it better, given that that was the case, to submit something, because then I can resubmit with something of higher standard and hopefully pass that time. And then on the Wednesday of this week, I realised like how much being ill knocks you, because I'd missed the lectures on Tuesday morning, and then came in on Wednesday, sat through the first lecture, which was on bone deformity, and then realised that I knew nothing about what was going on because I'd missed the bone lecture from the previous day, being ill. So I then went upstairs, caught up on the work from yesterday, in process missing the lectures from the Wednesday, but then I just had to do them that evening. You really don't want to be ill if you can avoid it, because stuff builds up so fast. You really want to try and stay on top of it. Thursday was pretty uneventful, other than starting the first CBL case of the block, which we're guessing so far is a hip fracture. Someone's fallen over like an old person, and one of their legs is externally rotated and shorter, I think, so it sounds like a hip fracture. But we kind of split up, did learning areas, so we looked at normal anatomy, physiology, and that kind of thing. And I think as a group, I've talked about this before, we'd like to think we're pretty good at the CBL process now. We know that it's not about focusing on pathology, it's about focusing on what's normal and making sure everyone understands that, so we can, generate our learning areas as per. But our new facilitator seemed to take some issue with the way we were doing things, which really is irritating for us as a group, because we went through this with our last facilitator. So we adjusted with the one in the last block to their way of doing things, and they seemed happy with that. That same way, because we haven't changed, doesn't seem to fly very well with our new facilitator. So what that suggests to me is that the facilitators do not talk between themselves about how people should be doing things. Like, we have guidance to follow as students. I assume that they do as well, in terms of the things we should be doing. But if I'm right, there seems to be a lack of communication between the facilitators themselves. So I think, given how the last one went, we're a bit resistant to change, because we really don't have the time to adjust how we're doing things to suit every facilitator. And I guess ultimately it's not about, for want of a better phrase, it's not about what the facilitator wants us to do, it's about whether or not we feel like we are understanding it. So we'll really just have to see how this one goes. Friday was hips and knees, so we learned to do hip and knee exams, basically just testing the functions of both joints. There are a few little interesting tidbits to that, but they're both pretty simple exams, and they'd be great, I think, to have as OSCEs. We did focus histories as well, so someone presenting with knee pain, for example, and we learned, what are the relevant questions to ask for joint discomfort. But yeah, it was fine. I think I wouldn't have a problem doing something like that in an OSCE setting. And anatomy was very good as well. We had a lot of hip joint stuff and muscles of the thigh, both of which I really, really like. The thigh is a bit complicated. There's 3 compartments, which means like 3 levels of muscle. There's the anterior group of muscles, then the medial group, and then the posterior group, and then there's the muscles around the hip as well. And some of the nerve supplies can be quite complicated, but actually the areas are really interesting and they do make sense if you can think about things mechanically. Played D&D Friday night with Tom and the guys, which was very, very fun. It's a new campaign that's kind of shaping up. But Saturday, so yesterday, I was meant to go to a conference. I was meant to go to the Birmingham Surgical Symposium, and I decided that I was just too exhausted to face the idea of a day kind of running around Birmingham. I think with it being a respiratory infection that I've got, I get like short of breath very easily, and I think I've strained my intercostal muscles or something in that area, because whenever I cough now, it makes me like double over in pain. It's very, very painful, and so I'm doing everything I can not to cough. And I just decided that I'd probably be better having a couple of days to rest, which is really what I've done. I've got a lot of work done, but it really hasn't been strenuous, and I think that was a good decision. I don't feel bad about. And today I got myself a gift and bought some new Sharpies, and I've been just going through and doing some drawings. I'm not sure how easily I'll be able to show you these, but got a few. I've got kidneys and pancreas. Oh, that's not a very good angle, is it? There we go. I've just taken them out for you. So we've got a nice kidney one. We've got the front and back of the liver. My favourite one, actually, it's quite simple, but I think it's come out as a really nice drawing, is this one of the heart. I do enjoy drawing. I'm not very good at it, as you can probably tell, but I find it nicely therapeutic, and again, you know that I really enjoy anatomy, so I think particularly old versions of things like Grey's Anatomy, I think they're beautiful. Like, you ask questions about why people, why do landscape artists draw landscapes, and why do, I don't know, why do people draw flowers or faces, that kind of thing. I think biological structures, by their kind of nature, they're evolved, obviously, through processes to be a beautiful form for, well, not beautiful in the kind of subjective humans find them beautiful way, but they are efficient and good at what they do. They're biological machines, and I think as things to draw, even in this kind of cartoonized way, that you get just such an incredible sort of series of shapes and structures to work with that, would people have ever devised them that way without the biological inspiration? I don't know. But anyway, I'm very much rambling about nothing at this point, so that's where I'm going to wrap the video. Thanks very much for watching, guys. Please be sure to hit that like button for me, leave a comment and subscribe if you'd like to see more videos just like this. I got a text from someone the other day who's someone I interviewed, and they've just got an offer to come and study at Warwick, so I will see you, Zach, when you come and study. It's so good to hear that you've got in, and I hope that more of you will receive your offers very shortly, and I look forward to seeing you, obviously assuming that I'm still here, when I'm in second year. So I'll see you guys soon. Bye.